Hi, on this podcast, the Back Pain Rant, I'd like to talk about why injection of stem cells into the disc might not give you the relief you're looking for. Hi, I'm Dr. Tony Mork, orthopedic surgeon, endoscopic spine specialist, and today I'd like to try to tell you why I think that stem cells and PRP injections into the disc may not give you the relief from back pain that you're looking for, particularly when these procedures are so costly. It's not good to be wasting your time or money, and I'm going to tell you why I think that they might not be so helpful. In the early 2000s or early to mid 2000s, I published a paper on the injection of stem cells into the disc space, and it was the fastest published paper that I ever had published. And there was a reason for that. So I had taken stem cells from the iliac crest, so not some of the fancy harvesting techniques used today, but I thought they were hematopoietic stem cells, and I injected them into people who had degenerative and annular tears and chronic back pain that wasn't really responding to anything else I was doing at that point in time. And I followed it even with hyperbaric oxygen to help out, not really realizing how bad the interior, or the environment, the healing environment was on the interior of these discs. So we injected them, follow them along, and also gave them concomitant hyperbaric oxygen. And as I said, the paper was published very quickly without any recommendations for corrections, which is pretty unusual. And the reason was because it was 100% failure. So I wondered, why this was the case, because I thought stem cells are almost like the Genesis project in a Star Trek type of episode where things could just be changed around. But what I underestimated was the environment that this was being injected into. The inside of the disc is acidic, has low oxygen content, and really not much in the way of any kind of nutrition. And then with we've talked about the fragments present inside these discs with annular tears, that probably the chemicals, inflammatory agents being created by the fragments breaking down just creates a very unhealthy environment. And certainly nothing that was going to support any kind of new cells being injected into the disc. And PRP requires a blood supply to be really beneficial. So, for example, it works really, I think, pretty well in the shoulder and knee, things with a blood supply. But inside the disc, there's not really much of a blood supply. So if you injected the PRP into the annulus or some of the soft tissues in the area, maybe it would work, but probably not injecting inside the disc. There's just nothing for the platelet-rich plasma to basically uh, nothing to happen in there. It's just a really poor environment to work with. So I think that stem cell injections, which I've heard people have quite a lot. Of course, everyone wishes that some simple injection is going to cure their back pain, but I think injecting cells that need some support, oxygen, as well as nutrients, blood supply, a good pH. I think that the reason that it's just not going to work is because there's injecting cells into a kind of an environment that's not supportive is just not going to work. The cells are just going to die inside the disc. And I think that's a pretty good reason that I think it doesn't work really that well. I'm sure maybe there's maybe other things are coming up in the future, but I think the current state of affairs is that if you're trying to treat annular tears or degenerative disc disease with some kind of stem cells, it's just not going to work by injecting them into a bad disc. The environment's too hostile. Anyways, okay, well, thanks for listening to my thoughts on stem cell injections into degenerative discs or annular tears. I'm in this episode, and I ask you to submit any questions you have. I appreciate your listening. Please subscribe to this channel if you'd like to hear more about other topics regarding low back pain, neck pain, any kind of spine pain that we've been talking about. And thanks for listening.